I'm Dr. Barry, licensed psychologist, and here we talk about true crime and psychology. Thank you so much for joining. Let's hop right into today's topic. Let's go.
Welcome. I really like doing mental health education and helping break stigma. And there is a ton of stigma that can already come with an autism diagnosis. And recently, there was some information that was put out about an association between Tylenol. When a pregnant person takes Tylenol and a child developing autism. I will tell you, there have been multiple medical doctors that have come out, and the American Association of Pediatrics, the American Psychiatric Association, pretty much everybody has put out statements that say, while so association does not mean causation. There is a huge difference between those two things. So, the fact that I can drink uh, black tea right before bed, and that doesn't make me sleepy, that's not diagnostic. It does not mean that I have ADHD. There are a whole bunch of other symptoms that point to the fact that Dr. Barry it likely has ADHD. I have not been formally diagnosed. And so association does not mean causation. There's a thing. So Tylenol is one of the only pain relievers. Let me look it up. So acetaminophen, that is what it's called. Um uh so normally acetaminophen is one of the only ones that I think was typically considered by most doctors to be okay. I'm not a medical doctor, okay? Let me give that disclaimer. I am not a medical doctor. I have heard medical doctors talk about this, including one woman who has had, I think, 3 or 4 pregnancies. 2 of her pregnancies, she had to take Tylenol for fever or headaches. And then one pregnancy where she did not take any Tylenol at all, and that child ended up developing autism. And Tylenol likely has no association. And so um Tylenol during pregnancy can be such kind of a common thing. Like genetics and a bunch of other factors. There could be environmental, there could be all of these other factors. There are all these other things that go into a diagnosis of autism. Okay. And so most individuals, when they are pregnant, they try to be mindful of what they do. Because sometimes during pregnancy, they'll say, hey, try to not drink too much caffeine. I could not have made it through my pregnancy if I did not have coffee in the morning. I would try sometimes. I think during my first trimester, I think I did decaffeinated because I was really concerned. First trimester can be a stressful time in general. But fevers, those things can be dangerous to a pregnancy. And so it's really important that people have safe alternatives. So Tylenol isn't something that's just typically prescribed, like, hey, just take this every day, even if you don't need it. So normally somebody would only be taking this medication because of something like a fever, because of some other reason. They wouldn't be taking it just for no reason. I like to share where I get information. And so I am going to share my screen because I do want to point out the fact that because I clicked on the research that the White House cited. So recently there was a press conference, I think it was yesterday, talking about a link between acetaminophen and autism. And once again, all of the associations have discredited this, but it does have links to different studies. And what I did was I went to those studies. So one of the studies cited is a Mount Sinai study. And in this study, they found prenatal exposure may increase the risk of some, but the study does not say that the use of acetaminophen caused autism. And every single study says additional research and studies are needed. Okay. And there was also a John Hopkins study that was cited. And once again, it said that there is an association, but association does not mean causation. And it's really, really important because, and then it can go to the American Pediatrics Association. They, that vaccines do not cause autism. And so I do have a link to those key facts listed below, and that any scientific research that says that there are issues, that there have been, they've been retracted due to fraudulent data. And so anytime a researcher is claiming something, sometimes there can be a specific reason. Okay, sometimes there can be a specific reason that people are saying certain things. I have not heard of this TikTok challenge, and y'all know I am on TikTok, and so please be mindful of what your kids, what people are watching and doing. You definitely should not take any pill for absolutely no reason. You should consult your medical doctor. I do like holistic doctors as well. I think are they OD? I don't know. So there are some doctors that are trained in like gut health, and they are medical doctors, but they typically take a more holistic approach versus just prescribing things. Okay. And so I've always been one that's really appreciated a holistic perspective. The reason why I really wanted to talk about this is because when autism first became a diagnosis, there were initial statements that it was caused by cold mothers, and that is not true at all, and it really hurt. Um, so if a mother has this child that has this neurodevelopmental condition, and then she's told that it's because of this, it can really just impact a person. Causes history. I want to pull up the exact research, because it's the history of what we thought caused autism. And so back in the 1940s to 1970s, they had what they called refrigerator mothers. And that was in 1943, a psychologist suggested that autism was caused by cold and unengaged mothers. And that is not at all true, which led to decades of parents being wrongly blamed and shamed for their children's condition. I think Freud tried to throw his hat into the thing, and I don't even really. And so, and he blamed it on psychological trauma and poor parenting versus it being a biological disorder. It was, there was a discredited vaccine link between the 1990s to the 2000s. And so there was a fraudulent study in 1998 that was later retracted by Andrew Wakefield that fueled the anti-vax movement. And so what modern science says is that there is a high vulnerability with genetics. Twin studies estimate. So they do twin studies where they take where they take twins, and they see what the twins end up getting. Because if two twins, and what can really happen is if two twins are raised in different environments, it can show an even stronger link. If they find situations like that, if they find a longitudinal study, or if they find a study where they can research twins, if they are raised in the same environment, you can look at genetics playing a role. If the twins are raised separate and they end up with the same diagnosis, then because they're likely going to be raised in two completely different environments, and if they still both develop the same condition, then that can do that. We are nerding out today. Okay. We are really, really nerding out today. And I really, I hope if you all I'll have a time for you all to ask questions, because right now I want to focus on getting this information out. And then I will let you know when to put your QQs, and I will answer any general questions that you all have. I can't answer specific questions because this is not like individualized medical advice. This is just general information that we're providing out on YouTube. Okay. And so let me go back to my links. Here we go. All right. And so twin studies estimate that genetics can account for anywhere between 80 to 90% of the factors in influencing autism. They've also taken a look at gene mutations. They have not been able to identify one single gene, but they are looking at mutations that can be inherited that then spontaneously occur during brain development. Okay. There can also be environmental influences and prenatal exposure. So if the mother is exposed to areas of high air pollution or certain types of pesticides before birth, and these are things that can be associated. Once again, it won't cause it, but sometimes these things can increase risk. Okay. Sometimes birth complications, so very low birth weight, oxygen deprivation, and there are some other things that can be linked as well. And when looking at the history of the diagnosis of autism, so in the DSM-1 was established in 1952. So we've only had the DSM since 1952. So there might be some psychologists that are old enough. I don't know, maybe 50. Yes. And so there are any psychologists in their like 80s or 90s that are still practicing, they might remember the DSM-1. There was no specific term autism. Behaviors that were under that under that type of behavior would fall under an intellectual issue, or it was a schizophrenic reaction childhood type. And we now know that schizophrenia and autism are two completely different things, but back in 1952, that was how they described things. In 1968, they also did not recognize autism as a distinct diagnosis, but they called it autistic atypical withdrawn behavior within childhood schizophrenia. In 1980, so the DSM-3 is when autism had its own specific diagnosis. And this was a significant advancement that separated it from schizophrenia. And it looked at the social unresponsiveness and repetitive behaviors. The DSM-3 revised was in 1987, and that replaced infantile autism with autistic disorder. And it had a broadened diagnostic checklist. So in 1994, so I was trained on the DSM-4, and the DSM-4, that was when they introduced Asperger's syndrome, childhood disintegrative disorder, Rett syndrome, pervasive developmental disorder not otherwise specified, and they also had autism. So there were those different conditions, and the concept of a spectrum was discussed that could fall under 5 different things. And that's really important to note when we talk about the rates of autism increasing. It's because there are no longer 5 different things. So individuals with Rett syndrome fall under the autism spectrum. They pretty much found that there was this spectrum of things. Lisa, I also still have my DSM-4. I think I have my 5 here. Yeah, I have my 5 right here. My 4 is gray. I probably have the 4 because I still have my grad school books. I still have all of those things. Welcome to everybody listening, and thank you all for nerding out with me. I really enjoy being able to share this type of information with you all. Okay. And so once again, DSM-4, there were these 5 different conditions that that we now in the DSM-5, which came out in, let me get back to my notes. It is DSM-5 was 2013. So 2013, the purple, because my DSM-4 was gray. This one's purple. The DSM-5 said that all of those different things, those 5 different conditions fell into the autism spectrum. And this revision created a more integrated diagnostic system, recognizing that autism exists on a spectrum of severity and presentation. And former terms were removed. So pervasive developmental disorder, not otherwise specified, Rett syndrome, childhood disintegrative disorder, and Asperger's syndrome, those ones overnight, DSM-4 to DSM-5 disappeared, and individuals that met criteria for autism spectrum fell into the autism spectrum. They did end up doing this social diagnosis. Let me find my links to that. Because with the DSM-5, and I do have my sources linked down in the description if anybody wants to dig into these things a little bit more. But there was this social communication disorder, and that does not fall under the autism spectrum. That is a separate diagnosis that's viewed as a communication disorder and not in the autism spectrum. Whereas individuals with Asperger's are considered to fall within that autism spectrum. Okay. All right. And so this whole thing, I think it's really important that we also talk about neurodiversity. Somebody asked me that the other day. What is neurodiversity? And so let me share my screen again. And once again, I have the links to these down in the description. And this comes from Harvard Health. And all right. So neurodiversity is just a term that describes the idea that people experience and interact with the world around them in different ways, and there's no right or wrong way of thinking, learning, and behaving. Differences are not viewed as deficits. And so individuals that typically fall under the neurodiversity, and so the word neurodiversity can refer to the diversity of all people, but mostly it's within the context of autism, ADHD, and learning disabilities. When we talk about neurodiversity and people whose brains work a little different, we're normally talking about autism, ADHD, and individuals with learning or speech difficulties. Okay. And when I say speech, because y'all know I have a stutter, and so, or a communication, yeah, I like speech versus, I know, and then if anybody has certain preferences, y'all can always put those in the chat, okay? And so words matter in neurodiversity, and that's where I try to use the words that most identify with the individual. Because there are some people with autism that love being referred to, like they identify as autistic. That like to not call them that, they would be like, that's weird. And so I try to identify with people the way they want to be identified. The way that I normally talk about it is the individual with that diagnosis. But if the person, but then I try to use the language that the person uses and respects. Okay. All right. And so, and I think it's really important to note that individuals with autism can live happy, healthy, can have relationships, can get married. One of my favorite, and I don't know if I've talked about love on the spectrum here. There is a Netflix show called Love on the Spectrum, and it follows individuals with autism, and sometimes they have somebody with it's normally autism, but it's on that autism spectrum that are looking for love, and they're trying to date. Sometimes they have them meet with a coach that kind of talks with them about communication and what went well on their date, what didn't go well. And they kind of give them some pointers on, like, okay, so when you go out on a date with somebody, and you can't just rapid fire questions to your date because they'll feel overwhelmed. And it's helping individuals that are looking for connection. It's helping them find that type of connection, or like possibly increase their success. But because sometimes the person might not realize that, like, asking questions, that can be triggering and overwhelming for the other person. There have also, with Love on the Spectrum, there have been individuals where the date was too overstimulating and they had to ask the producers to, like, move to another table, or in the middle of the date, the individual got really excited and they were able to take a break and go to the restroom. Love on the Spectrum is one of my absolute. I think it's really cute, and I think they do it in a respectful way, in a way that's not shaming or that's not making fun of individuals with autism. And so, yes. Um, and so there are many individuals with autism that are able to function independently, and there are some that live in group homes. There's actually a group home that's right close. That's in my neighborhood, and the staff do a great job of just because sometimes people have concerns if they learn that there is a group home in their neighborhood, and this is for adults that are on the spectrum. And the residents and the staff, we haven't had any major issues with this particular one. There was another group home in another area of our neighborhood where I think a resident kind of got confused, and they were able to get support from the group home staff, and everything worked out. There have also been advances with individuals that are so it was harder for two kids could present with the exact same issues, and if one was a boy and one was a girl, the boy would get diagnosed with autism. The girl might get diagnosed with anxiety or maybe ADHD, but sometimes the girl didn't always get a diagnosis of autism. Similar situation with a white boy that presented with symptoms and a black boy presented with symptoms. The white boy might get diagnosed with autism, and the black boy might get diagnosed with oppositional defiant disorder. And so there has been some bias with presentation, where clinicians have had to get additional training on how to identify how autism in girls presents, how to understand cultural differences with how autism can present, to make sure that individuals that are presenting and that meet criteria for the diagnosis, that they are getting early intervention. I also heard a pediatrician talk about how important early intervention and screening is. So I know from the time our kiddo was between 18 months and 2 years old, they were screening his verbal ability. And if by 2 years old, if our kiddo was showing a speech delay, early intervention is really important. And if somebody does have a young child that they are concerned about, and if you are in the United States, sometimes there are these child find or child help assessments that you can get through your school system. Sometimes, if you have the resources, if you have insurance, you can also get outpatient speech therapy. If you have TRICARE, if you are a service member, there is a exceptional child program where now if your child so for military, I do like to give that caveat that if you do if you do look into the exceptional child program, sometimes that can limit where the service member is deployed, because they will make sure to only deploy the service member to areas that have resources for their exceptional child. An exceptional child could be autism. It could be a variety of different things, but there are resources and tools out there. So I know individuals that have received ABA through TRICARE, that have received home-based speech therapy through their insurance, because we know early intervention is really important. And that's why I said also your local school system, because the school system doesn't want a child to struggle from 2 to 5 and then make it to school for kindergarten. And there are issues with potty training, there are issues with speech, there are all of these delays that now it's going to be harder to catch this child up. If at 2, 3 years old, we're noticing that there might be some difficulties, and there are a lot of different reasons for delays. So some people just have a speech delay and there is no autism. There is no other, like, a child can just have a speech delay. A child could be having potty training issues and it not be related to something else. You don't know until you get assessed. And so doing those assessments and screenings can often be really helpful. Yes. So it's the Exceptional Child Program. Let me find Exceptional Child Program Military. All right. So Exceptional Family Member Program. That's exactly what it's called. And I will share my screen once I make sure that I'm displaying the right things. All right. I know some people, I'll be completely honest. I know some people have not wanted their child, which is like, that's a whole other conversation that we're not going to have today, where they've paid out of pocket so that the diagnosis wasn't registered with TRICARE system because they didn't want it to affect the service members' promotability or any of those things. But yeah, so it's a whole thing, but, um, so it provides care and services for family members with special needs, whether it's a spouse, a child, or a dependent adult. That is the Exceptional Family Member Program. And there are resources and tools. You can find more information. There is an advocate newsletter. And so, adults with special needs, educational needs, and the Exceptional Family Member Program. All right. I like to share these resources because you don't know what you don't know. Thank you, Tammy, for sharing this. In Florida, it's called Early Steps, and it's for kids 0 to 2 years old. And the earlier the intervention, the better. Okay. And so when kiddos are getting the supports and help they need, it is so much better. So I've been honest on this channel. My kiddo had a stutter from right about the time he started talking, or maybe he developed a fluency issue where he would get stuck on his words from about 3 years old until about 5 or 6 years old. And the school didn't have any issue with it. The doctor didn't have any issue with it. But my husband and we were getting feedback from the school that our kiddo, he just wasn't talkative. He was kind of shy. And we could see that it was affecting our kids' confidence. So I did the research. I found a speech therapist. I'm in a mommy Facebook group, and I was like, "Hey, who do y'all recommend for speech therapy?" I found 2 or 3 different places. One was in network, one was not in network. The one that was in network did not call me back. The one that was not in network, and I think because we did 30 minutes of speech therapy for, I think, about 6 or 8 months. I think out of network, I think it was $50 a session. It was around 50 or 75. It was under $100 a session. And so we were in the position to just pay out of pocket, and our kiddo received one-on-one speech therapy for somewhere between 6 to 8 months. Towards the end of speech therapy, my husband and we could tell our kiddo had made significant progress. And when I say he had a fluency issue, he would get stuck on his words. And I knew that. So growing up, I needed speech therapy, but I did not want to get that special help at school. So I grew up with in the 80s and 90s where my mom, lovely, amazing woman. Y'all know I love my mom. But we had this mentality that there's nothing wrong with you, or if there is something wrong, you can push your way through it. So I learned on my own how to push through when I got stuck. So I know if I start to feel myself getting stuck on my words, I can slow down, I can take a breath, and then my words will flow out more freely. My kid learned soft touch. So that's a speech therapy thing where when he starts getting stuck on his words, and we call it his bumpy speech, when his speech starts to get bumpy, then he takes a breath and he stops trying to force it out, and he does, and they practice soft touch. And he does that, and that's really helpful. And so, I wish that I had done therapy when I was my kid's age, and I wish that I had done speech therapy. I think both of those things would have been really helpful. And just because a kid needs speech therapy, it doesn't mean that the parent is doing anything wrong. If a kiddo needs outpatient, needs psychological, needs mental health counseling, it doesn't mean that there's something wrong. It just means that we need more support. There's something going on where we need some additional support. And so, I I love that there are resources, there are things out there, and I don't want there to be this stigma that, people are trying to avoid an autism diagnosis. So, to me, when I meet with somebody and I'm like, "Ooh, I think they might be on the spectrum," and I refer them for services because sometimes this child is getting in trouble for not eating what's cooked. They're getting in trouble for losing it at school. But when I talk to them, they're getting overwhelmed by sensory information. They're getting in trouble because they keep being mean to their peers, but they're telling me like, "I'm not being mean. I'm just being." They have no filter. So these are the people I've worked with. They've had 0 filter. And sometimes the adults in their lives are thinking, like, are they a sociopath? Like, they lack empathy, all these things. And then when I'm talking to them, I see they're just struggling with somebody else's perspective, and not in a vindictive, mean, I'm trying to control you way, more in a like, I have difficulty seeing anybody else's perspective other than mine. And it comes off in a very neurodevelopmental way. And I often refer them for evaluations. I refer them for assessment. Almost everybody I've referred, almost all of them, they have like I have a pretty good I don't wanna say I can diagnose it from the lobby, but, there's just a way. There's I can look at a situation and I'm like, "Are we dealing with a possible autism spectrum?" And W and to me, once a person better understands how their brain works and what works for them, it then allows the people in their life to be more supportive. Because I've also worked with kiddos that they're having all of these meltdowns, they're having all of these difficulties, but it's because their home has no structure. And we need some structure, we need some predictability, we need some additional supports. And once those things are in place, that's been incredibly helpful for them. And so because often individuals with autism are forced to fit into a world that's not made for them. So most scissors are made to be right-handed scissors. People that are left-handed have to, like, search out and find. I don't even know if at the store, I don't even know if they sell left-handed scissors at the regular store. Like, I think sometimes you have to search out left-handed stuff. I don't mean to minimize it, but I want to give a comparison that that's sometimes what life can be like living with autism spectrum disorder. You're constantly trying to fit into a world that was not made for you. And so that's where I try. There are little things we can do. So I love on cruise ships, they sometimes have silent parties, or sometimes schools will have silent parties where individuals are given headphones and they're able to control the volume of of the headphones, they'll have sensory friendly nights. Our local movie theater has a sensory friendly night where or time for certain for certain when they're airing certain movies, they'll have a sensory friendly option where individuals are able to manage the loudness on their own. And but those things are things that individuals with autism have to speak out. It's not something that's automatic. And so do do do. Okay. Sometimes the walking on tippy toes is more of a sensory thing and only walking on your tippy toes. So I've worked with some individuals that they have strained their calf muscle, like they won't walk heel toe, like they will only walk on their tippy toes as they're even in elementary school or almost in middle school, and that can cause issues. That can cause physical issues. So sometimes they've had to do physical therapy or occupational therapy to work through that. So just because a child walks on their tippy toes or it's idiopathic toe walking, it's a common behavior seen in individuals with autism, but it doesn't mean that like it's an automatic thing. Some possible reasons for it is sensory processing. So something about how the brain is processing information about movement and leading to some difficulties with coordination and stability. Because I've with the individuals that only walk on their toes, they tell me it feels weird to walk the other way. Um, there can be some neurological differences. Individuals with autism, sometimes their brains process information, especially motor and sensory information, a little bit differently. Um, and then uh, um, and then anxiety and stress. Sometimes anxiety and stress can trigger toe walking. When to seek evaluation if a child is excessively doing toe walking beyond 3 years old. But it can be a sign of a bunch of other things. It does not necessarily only point to possible autism. Just because a child lines things up does not necessarily mean that they have autism. Kids with anxiety like order. Anytime I see a kiddo that's diagnosed with OCD, ADHD, mood or depression, and like oppositional defiant disorder, I'm always like, wait a minute, did we miss autism? Because that coordination of things can sometimes point to undiagnosed autism. And so with autism, there can be a rigidity where it's very difficult when things changing, things not going the way the individual wants. That can be very, very stressful. And so, a lot of the work that I do with clients is what we call growth mindset. A lot of treatment is about how do we be a little bit more flexible. So, if we get to their preferred restaurant, let's say it's McDonald's, and that day McDonald's, they are out of chicken nuggets or something, because for some people that can cause major meltdowns that can ruin the rest of the day. And so I love that. So I'm telling you, anytime I see OCD, ADHD plus mood plus like sometimes I'm just like, hey, and that doesn't necessarily, because sometimes a person can just have OCD and ADHD. Like that doesn't necessarily point to autism, but like, and if they have sensory issues and if there are these other things, I'm like, oh, let's just get checked. um Getting an accurate autism diagnosis can definitely be difficult. In our area in Fredericksburg, Virginia, there was unfortunately an individual that was posing as a psychologist, but she was not an actual psychologist. So, fake psychologist, Fredericksburg, Virginia. So it comes right up. It was back in 20. It was Sharonda Avery. Uh, she impacted our area in a negative way for years to come. Unfortunately, and curiously, I see your question. I'm gonna flag it and talk about that. So let me share the news article so we can look at this together. Okay. Um, and what ended up getting her caught? So she had treated more than 100 patients while posing as a psychologist, and she had no advanced. So I don't even know that she had a bachelor's. Uh, but she claimed to have had a bachelor's, she claimed to have all these things, and she did not have any of those things. And it became so bad that a school district, because people would go to this individual, and she was diagnosing everybody with autism. Like, she was everybody. It was mm, reminds me of that other doctor in dissociative identity disorder. Like, she saw autism everywhere. And so, what ended up happening is a lot of individuals that she assessed, they had to get reassessed, and by an actual licensed psychologist. And but what ended up getting her caught was a school psychologist in Stafford, Virginia, got fed up of her reports. And they did some investigating. They asked a whole bunch of questions. They got really nosy, and it led to a federal investigation. It led to a bunch of complaints, lawsuits, all those things. Great question. Is trichotillomania linked to autism? So trichotillomania is like plucking. It's like skin picking, or hair. Trichotillomania. I have worked with individuals with that particular diagnosis, and it is. I think it's in. Let me see what section it's in. Um, so sometimes individuals with autism have ways of calming. So sometimes individuals on the autism spectrum, especially when they're younger, they might do. They might engage in some forms of harm. So, like, sometimes head banging. So safety is always a concern. There are individuals that are not on the autism spectrum that engage in this type of behavior. I think is it in the obsessive? Yes. So trichotillomania is in the obsessive compulsive and related disorders. Okay. Page 251, DSM-5. I want to see what they say about autism in the comorbidity section. No. So it is comorbid with anxiety disorders. And then let me see. Oh, wait a minute. I was on the wrong section. Sorry. Differential diagnosis. Yeah. So there's nothing in the DSM-5 specifically about autism spectrum. Okay. All right. What is your opinion on the suggestion of using, and I can't say that, and I did laugh. So that particular medication. So I would encourage people to talk with their medical doctor. It is my understanding that there is no cure for autism. Okay. So my understanding of the research of what's happened is that some individuals, so that medication, I believe it's like folic acid. That's which normally, while people are pregnant, they try to make sure to take folic acid during pregnancy. But this is no, sorry, my bad. It's not folic. It's Folinic acid. Okay. A high dose prescription drug to counteract the toxic effects of chemotherapy. That's how it's typically prescribed. And some studies have shown that in some individuals, it can improve communication. Okay. So one study in 2000, 1 in 150 children had autism, 3.4 times more likely boys more likely than girls to be diagnosed. And okay, but yeah, okay. What the research says about the folinic acid in a small group of children. So it's a very small group of children. So this is a group of 39 kids, okay? So 39 kids were administered the treatment, and a second group of 38 kids were given a placebo. And a 2024 study, so this is very, very small, so more research is needed, um, saw improved scores. So I would have to see exactly what that research was to see if the difference is even statistically significant, and it could be. But the differences have been very small, and it's my understanding it can be the findings have been inconsistent. Okay. I think they are pushing the FDA to increase the use so that more doctors, but like you want to research it because are there any downsides of giving individuals this medication? I don't like so you would want to know what some of the long-term effects are. There is no cure for autism. There are some things that can help reduce symptoms. Sometimes there's some individuals that with intervention they can their symptoms can become less and things might be more manageable for them. Okay. And then there are some individuals that will continue to need high levels of support. I do think so if a child is non-speaking, like if they're not speaking, um, I think giving them a communication device is very important. So typically in speech therapy, they will give them some type of like it's like a tablet or it's a little communication device and making sure that that child has that communication device with them at all times because that communication device is their voice. Individuals that struggle with communicating verbally need nonverbal ways to communicate. And that could be like stop with their hand. It could be some people use sign. It could be more. It could be, I think that was more. I think that's eat. I think this was more. Like you want to find ways to communicate. In applied behavioral analysis or ABA, they will sometimes do these boards where a child can point to what they want or to what they need. So encouraging communication can often help reduce frustration, and reducing frustration can be incredibly important because we all long to kind of help other people know how we're feeling. And if you struggle to communicate that, that's when there can be an increased risk of aggression to self or aggression towards others. And also consistency in the environment is so important. And people understanding and adjusting to what this individual needs. So while this individual might be 15 years old, they might not, they might need reminders to brush their teeth every day, even though they're 15 years old. Even though they're 15 years old, they might need reminders to bathe, at an appropriate whatever time, whatever's set up within the family. And people might need supports around that. Okay. So, exactly, Peg. Exactly. And so, um, I'm glad that y'all kept it classy in the comments. Y'all are amazing. I got nervous about doing this live. You all are phenomenal. Let me know if y'all have any questions. Okay. Uh Lisa said, I saw a video last week with a mom of a child who was nonverbal for a long time. Her advice was to keep talking to your kids. Yes. And then also help them find ways to communicate. And because sometimes even in speech therapy with a child that has a device, they will also continue to try to find other ways. But nonverbal communication is a different part of the brain versus speaking. Speaking comes from a different part of the brain versus nonverbal. Nonverbal communication, um, kids can normally like they can sign before they can speak. So that's why they talk about teaching babies sign language because often a baby's frustration, if they can sign more or they can sign eat or they can sign whatever they can sign, often that can help. I'm not a medical doctor. And so people would have to talk with their medical doctor about options. I also want to be careful that we're not causing pain. Sometimes individuals that are on the spectrum, they might have difficulty communicating when they are in pain. And so I will leave that one for the medical doctors. I do know that the American Psychiatric and American Association of Pediatricians, something like that, they both put out statements saying that the that acid has not been recommended for treatment of autism. It will require more years of research to know if it's an appropriate treatment for individuals with autism. Autism spectrum disorders have a spectrum of neurodiversity, and we have to make sure that we expand care based on evidence-based treatments. That was from the American Psychiatric Association. And then I did have the American Pediatric. Let me see. Did that one go away? I might have clicked off of it earlier. But I have a link to their statement as well. Yes. Okay. Yeah. No worries. No worries. Yes. And the only reason why I'm saying to be careful is because um if it was my child, because sometimes parents get desperate when they desperately want their child to be able to communicate with them, but we want to make sure that we're not causing harm. And I think that's really important because sometimes there can be a lot of emotions the parent goes through when their child does get an autism diagnosis. And for me, I don't want things that are being said to make people lose hope. And so I wanna make sure, so speech therapy is really helpful. There are a lot of different things that people can do. Yeah, I didn't think you were planning on doing those things, and it's normal for people to have these questions and for people to want hope, for people to want new things, but we have to do it safely. And so I'm sure there might be clinical trials that come available where individuals can, but with a clinical trial, some kids are gonna get the placebo. So that's where I said I would want to know what's the difference, because let's say the difference was the kids that received the medication spoke 5 words, and the kids that did not that received the placebo, which meant they got a sugar pill, they got nothing at all, they spoke 2 words. Like, that wouldn't, I don't know if that would be a statistically significant difference. So there might be more, but more doesn't mean statistically significant from not receiving anything at all. Sometimes just um, the parent, because maybe when my child, I'm taking this pill. So like the parents that sign up for this clinical trial, they're saying like, hey, we're researching the effects of this in communication. And maybe the parents talk with the kids more. The parents have this expectation, my kid might be able to speak more. So sometimes expectations can, so maybe just the idea of the parents thinking, having a little bit of hope, maybe the parents did some things different, or I don't know, like the speech therapist did something different. And so I just, causation, nah. So correlation does not mean causation. Just because something is correlated, it's associated, does not mean it causes it. And then also, just because there's a difference does not mean that it's statistically significant. All right. And so, Barbara, and that's where if I don't, so and that's where I think each parent has to decide what's best for them, and I would want to know the risk. So if my child is recommended to try this experimental thing, I would want to know what are the risk. And Lisa, exactly. Sometimes studies can be manipulated. And so that's where I try to get evidence-based ones that are peer reviewed. Sometimes there can be like a blind. So sometimes the researcher doesn't know who's in which group. So that's I think it's called double blind study, where the participant doesn't know if they're in the group, and the researcher doesn't know who's in what group, because sometimes there can be bias that comes into research. Y'all are making me remember all of my old like statistics. So I got a PsyD, okay? I have a doctorate of psychology. My degree was not science-based. I'm not a PhD, so PhDs spend a lot of time on doing additional research. So as a PsyD, I still took research. I did a dissertation on forgiveness and aggressive children. I still took statistics and all those things. I still know all this stuff, but like I haven't had to think about it in a really long time. All right. All right. And so Tammy, I agree. It's interesting that families that can accept a diagnosis, well, and so sometimes even with if a child is deaf or hearing impaired, sometimes the parent asks about the cochlear, like the implant. So sometimes people do still want their child. Sometimes people do still try to search out other things. They do. I don't know. I've seen both. I've seen both. I just think intervention is important, hope is important, and for parents to know that, like, there there are options. Their child can still have like, at 5, we don't know what they're gonna be like at 18. Like, we don't know. I can't predict. If I'm working with a 15-year-old that's really struggling with functioning on their own, I will have concerns at 18. Will they be able to function on their own? So that's where I'll start working with the family on like, what's our plan at 18? And then if I'm working with a 20-year-old that's still struggling with independent living, that's when I'm supporting the family with like, okay, we need to go in ahead and apply. Like this individual is not able to work full time. They for this, like, so for certain cases, if this is true, so the goal is always, hey, let's see what we can work towards. In our area, I will share. I think it's George Mason. I wonder if they still have that program. George Mason University. They have an autism program. It is a supportive program specifically for individuals with autism that can attend their university. Let me share my screen. It helps me when you share your screen. All right, here we go. I can't just push the button and it automatically do it. Okay, let me make myself small. He's so small. My kiddo might come up and ask me to feed him. I am going to feed him. Okay. So, George Mason University in Virginia, and there might be other colleges that have similar programs, but they have an autism support initiative where individuals on the autism spectrum are able to receive, like, they're in a special program that is smaller. And a learning strategist meets with the student 1 to 2 times a week. They have peer supports. They have specific classes within their program. They have specific social events. They do have information sessions on this program. It is for individuals that would struggle in a traditional college setting, because I know individuals that have went to that type of program, and they were like, oh, like this program was for individuals that were maybe that needed additional support. And so uh and I know an individual that graduated from that program and is now, I think they're a basketball coach. I think they coach basketball, and they were able to get a certification through this program. And so that's where, but there are colleges offering programs like this where individuals on the spectrum can receive supports and services. If you have a child that is looking to go to college and they are on the autism spectrum, they have ADHD, they have severe anxiety, they had a 504 or an IEP in school, you can reach out to what's called the accessibility office. Every college has an accessibility office. And now, are they going to have an IEP in college? No. Are they going to have, like, if a child had a lot of support in high school, are they going to have the same level of support in college? Maybe not. But it does set up certain things where maybe they can record the lectures. Maybe they get one-on-one time with a professor. Like the college comes up with a program that is helpful for them. The cost of school, so the program I was talking about, it is not free. I think it is eligible for financial aid. So the cost of that program was $7,200 a year for the 2025-2026 school year. That was the cost of that specific program. And I don't know if there are any other costs that aren't included. Now, the accessibility office at any university, that is free. So if a student needs supports, so I've worked with students that during their first semester in college, they struggled and they ended up on academic probation. We are often able to submit medical documentation to the school so that so that the school is aware of a medical condition, and not that they but sometimes it can support them in in transitioning back to the school if that's what they decide to do. Some people decide to not go back to the college, like if maybe that environment wasn't right for them, or whatever they need. But if they do decide to go back to school, and if they need additional supports, going through the accessibility office can often be helpful. And I wish more people knew about some of this stuff. I so appreciate you all. I have my final 2 sessions of the hands-on didactic EMDR training. I think on Saturday. We'll see. We'll see what happens if I talk about that or if I talk about a case. I was taking a break from some of the legal stuff. I've been following like some of the legal stuff that's been happening. And if there are any specific cases that y'all would like for me to talk about, feel free. But if you ever recommend a case, please ask, like, what is the thing we want to learn? Like, so what's your question? So if we're looking at the, you know, whatever the case is, what is it that we're gonna learn from it? Sometimes you mention a case and it's so over the top. I'm like, oh yeah, yeah, we definitely have to talk about that one. But I hope y'all enjoy the rest of your week. I will see. No, we're celebrating my husband's birthday on Saturday. I think I'll see y'all on Sunday. Okay. So I'll see y'all on Sunday, not Saturday. We're celebrating my husband's birthday on Saturday. So I will see y'all on Sunday around 2 p.m. I hope y'all have a good one. I will see y'all next time. Yeah. I think we'll have to talk about it. We'll have to talk about that one, Lisa. I hope y'all have a good one. Bye.